Hi, this is Jonathan Marks, and I'm here on the line with Kevin Anchel, Ph.D. He's going to be speaking at the 2017 annual meeting of APSARD, the American Professional Society of ADHD and Related Disorders. That's happening this coming January 13th to 15th at the Mayflower Hotel in Washington, D.C. Dr. Anchel is Associate Professor of Psychology and Director of Clinical Training at Syracuse University. He's also got a practice at Upstate University Hospital in Syracuse, New York. He's going to be leading a symposia which is made up of 4 talks on ADHD in college students, and his own presentation is entitled Malingering of ADHD in College Students. Welcome, Dr. Anchel. How are you?
I'm doing well, and I really appreciate the opportunity to get the word out about our symposia.
So the first thing, let me ask, define malingering for us so we understand what this is about.
So malingering is the conscious faking of symptoms in order to gain an ADHD diagnosis.
This is a big problem on college campuses?
It's an increasing problem on college campuses, yes. My talk is going to be exploring the relationship between stigma of ADHD and malingering of ADHD. I'm going to be presenting data from college students in general, so not college students with ADHD, but how college students without ADHD perceive ADHD in terms of the stigma related to ADHD, as well as how those perceptions are related to malingering of ADHD. And our data would suggest that college students are less stigmatized by ADHD than, say, things like depression or schizophrenia. ADHD is perceived by college students as more of a learning disability than a psychiatric disorder. Mm-hmm. And our data suggests that there's a correlation between how college students perceive ADHD in terms of stigma as well as their opinions or their perceptions on malingering. Mm-hmm. And college students that hold lower levels of stigma towards ADHD reported being more likely to engage in conscious feigning or faking of symptoms in order to gain an ADHD diagnosis.
Right. How well do medical professionals suss this out in terms of giving medications improperly?
You got at the underlying motivation for this particular study is to be able to explore stimulant misuse in an effective way. So to answer your question, I think there's a tremendous range in terms of how well prescribing physicians are able to accurately diagnose malingering when it is present. Malingering of ADHD is a particular issue in college students. In fact, this is the population in which it happens most often. And so this is our main motivation in exploring this particular topic in college students, is this the group that's most likely to do it.
Right. And is there some kind of effort to educate college physicians about ADHD so they're more knowledgeable?
Yes. There are a number of organizations across the country that are all focused on college student health care. And at a number of those organizations, there are ongoing efforts to increase ADHD awareness. And I can tell you because I've spoken at a couple of these national conferences for these organizations, and they are very interested in learning more about ADHD.
Great. So I've been speaking with Dr. Kevin Anchel of Syracuse University. He's going to be speaking at the 2017 annual meeting of APSARD, the American Professional Society of ADHD and Related Disorders, and that's coming this January 13th to 15th at the Mayflower Hotel in Washington, D.C. We expect this to be a very exciting meeting. Thanks for being with us, Dr. Anchel.
Thank you very much for the opportunity.